We're going to take a minute of moderators' time here to sort of reiterate some of the points that have been made, but to give sort of a state perspective from the Results First initiative's perspective. What we're doing with Results First is a couple of things. One is essentially we are trying to clone Steve in bringing the model that Steve and his staff have developed into the policymaking process in other states, working now in 14 states and a couple of California's counties. And not only to deal with the issue of replicating the model, which is basically taking the approach and replacing the Washington state-specific data with Iowa-specific data so that we can do this cost-benefit analysis, return on investment analysis on, and provide the same type of information to policymakers in the states, but also to tackle the issue of translating the information to the policy process so that policymakers will actually do something with it. The second thing we've done is try to get an idea of where this field is, particularly at the state level. And this summer, we issued a report based on a comprehensive assessment of cost-benefit analysis that were produced by states at the state level over a 4-year period. And in doing so, we tried to get a very strong perspective of where states were. We identified about 1,000 studies that looked like they potentially were cost-benefit analysis. We subsequently weeded about 2/3 of them out, and then really looked at what they included. Did they include basic things, which I think everybody in this room would agree, gee, a cost-benefit analysis really should do? Did they measure program cost and benefits against some type of a baseline? Did they assess both direct and indirect costs? Did they do some sort of discounting? Did they monetize tangible and intangible benefits? Did they describe assumptions? Did they do some form of sensitivity analysis? We were pretty merciful in our ratings of states in doing this. Out of the 384 studies that we assessed, fully 11% of them met all 6 criteria. And monetization was by far the weakest area. So I think that there is substantial room for improvement in the field out there. And looking across this room, I mean, this is an eminent panel of folks from the leading minds in the field from some of the strongest universities in the country. Unfortunately, the folks doing a lot of these studies didn't make it into your programs and probably weren't your best students. But they are out there doing this. And what we're seeing is, as the panel said, there's a great hunger in policymakers to identify what works and to direct information to them. And advocates are picking this up. And right now, if you go into about any legislative appropriations committee, about every advocate who comes forward asking for money will say, if you give me money, I will produce 50 cents, $5, $5,000, $5 million of return on every dollar you give us. And what that means is there's on one hand, a great opportunity for the field to influence policy. On the other hand, a real risk that the credibility of the field will be destroyed unless there is a baseline of practice that is being established. And that is critically important. And I think in thinking about the panel, what it needs to do moving forward is to recognize that there's areas of practice, as Lynn said, that are difficult to reach consensus on, but that there are some fairly basic things here which are going to be important for maintaining the credibility of the field, because the field is at a perfect way of informing the tough choices that are before us, but only if we maintain the credibility and establish a standard of practice that's there. And this is not a unique situation. I've been involved in standard setting in a number of different fields for bizarre reasons, but if you look at what GAO does for the standards of program evaluation, there's a standard setting process there that has established a baseline of what program evaluation should include. AEA has done the same thing. Government Accounting Standards Board does this for the accounting field, with the idea that when someone comes up with an accounting statement and an audit, that people say, yeah, this means something. That's not something that happens overnight, but it is something that the process starts, and then we establish a field, and then we deal with issues, and then you go through this iterative process. So I think that the baseline issue here is the field needs to start moving forward in this area, and if we can do that, then it's going to maximize the impact that's out there. One other thing that I wanted to mention, because the clearinghouses came up, I think the clearinghouses can play a critical role of collecting the information that is being produced by cost-benefit analysis. and by strong evaluations. Because as a policymaker's perspective, these decisions are being made, they're being made in real time. And you can't be in a position of, if a member says, tell me what works in early childhood education, or tell me what works in workforce education. You can't say, give me about a year and a half and I'll do this lit review and come back and tell you what did it. If Steve and his staff have spent about 20 years now doing a lit review, and I guess you've looked at about 25,000 plus studies at this point to identify what works. That there are clearinghouses out there. We've looked at all what the clearinghouses are doing. They're all doing good work. They vary somewhat in what they're doing. One of the challenges of using the clearinghouses is just the nomenclature of how they identify what they've found. Looking at the 8 clearinghouses we looked at, their best tier of programs are alternately called well-supported, top-tier, effective, proven, positive, strongly positive, or my favorite, score of 3.0 to 4.0. So if you're in a competitive situation and trying to say, I've got a great program that is proven, then it would be helpful if the clearinghouses could at least agree on what we want to call good programs, because I think that would make life easier. Recognizing there may be good disagreements on how we score evaluations, but once we've found good evaluations, if we can agree what to call them, that would be a step forward. So want to open it up now for the audience for questions of this panel in terms of how people view the CBAs that are being done and how that can be strengthened. Yes.
Hi, I want to first say thank you to this panel. It was extremely motivating, and compared to some of our other panels, I think a little uplifting, made me feel kind of warm and fuzzy that we've got a lot of promise ahead of us. I had a specific question. Gary, thank you for talking about the great work that y'all are doing at the Pew Center for the States, but specifically, because Jens isn't here, Jens mentioned kind of a thought experiment that could potentially be done in the context of this work or moving forward around identifying when benefit cost analyses are used to kind of the detriment of the field in public policy settings in particular, and thinking about kind of the importance of not only setting standards so we can move the field forward, but also to protect the field from wild, statements about how great this is or isn't. And so I was thinking about the report that was recently done around states using benefit cost analyses, and what a wonderful data source that probably is in terms of the cataloging. And I know that you did a lot of work around interviewing and kind of figuring out what was out there, and that may be a great starting point potentially for doing some of the work that Jens was mentioning around where was it used well, where was it not used well, where did the debate kind of spiral out of control with wild numbers being thrown around, and maybe where it was used in a way that kind of lifted the whole debate up to a higher level. So,
yeah, I think that probably one of the more interesting and somewhat disturbing findings was we found no relationship between the technical quality of CBAs and their use in the policy process. Meaning that policymakers, once they hear the term CBA, I think that they assume it meets a certain quality. So whether it was a technically strong CBA that everybody in this room would say, yeah, great job, guys, it means something to policymakers. We need to make sure it means something to the field at the same time.
I have a question, and it's because of the complexity. So it's for all of you, I guess. So we know that things like Head Start have their own standards, right? And is there a monetary value do you place on social emotional domains, for example, or cognitive domains, which are, which one do you put high up? We also know that we have blended funding, so that you're not just doing funding for Head Start, you're talking about pre-K and childcare. So how would you think about a cost-benefit analysis around that kind? Around that kind of complexity, because it's not just for just one program; it's multiple programs within one, looking at domains that, which one is more important to keep the program going. So if you could talk about that.
That's an excellent and a very hard question to answer. And I think that, we are trying very hard to look at the whole child and keep that in mind as we, consider any of the options that we have. I think if research and lessons haven't taught us anything, it's that, a child does not advance in one domain of social, emotional, cognitive, or otherwise, if, health. So I think that is a very important thing that we're trying to look at. And I know Kathy had lots of things to say about the federal agencies, but we really are trying with the programs to look at how we bring what I say both horizontal and vertical alignment to our programs. And so when you talk about pre-K and Head Start and childcare, we are actually doing a lot of work trying to establish baseline standards. One of the things that I didn't say and I think is really important is how do we define quality in this country? And I'm always sort of, hesitant when I hear that term used because we don't really know what it means for the most part. It's a very hard thing to get our arms around. But all that said, we are looking at how we bring these things together because, in sort of my view, and I think the view of most people in early childhood, it doesn't matter where a child is. What the child needs and deserves, it should be consistent. So if a child is in a child care setting, a pre-K program or Head Start program, they need and deserve a certain level of, quality and care. And I think that's what we've got to get to in this country and not do this bifurcation of children or programs for that matter. So we're spending a lot of time trying to work on that, and obviously between the Departments of Education and Health and Human Services with the President's Initiative and also with the Race to the Top, which Jacqueline was instrumental in, we are looking at bringing down these silos. I want to make one other comment too because I think it's also important, and that is cautioning sometimes about how we use research and evidence to inform policy, because I think in certain, at certain times, what we tend to do is it gets misinterpreted into policy. And I was thinking about some of the results of even what's been going on with the cost-benefit analysis recently. And, when we take these studies and we assume that they translate into a certain policy, we make big leaps. And I'm thinking right now of some of the work that's been going on in terms of how we fund programs based on this. And, we're right now struggling, and it is the dilemma that we have in childcare, and I'm going to try and wrap this up, but that we have in childcare is whether you fund the program, if the funding follows the child or the funding goes to the program. And what we've tended to do with the cost-benefit analysis that we've done recently is assume that the funding needs to follow the child, but that doesn't bring stability to the program. And so the program churns as the children churn, and we lose quality because of that. And so I always want to caution people to be careful how we interpret some of these types of decisions, and certainly cost benefit, to not overinterpret them and make a bad decision based on them. So I think I kind of went around the maypole there, but I think we're looking at the whole child.
Can I talk about one or two more questions?
So I had sorry, can you hear me? I had a question we really enjoyed all the presentation. I think it was very informative for me as a researcher. The one thing I heard throughout was the policymakers are hungry for evidence, and the evidence thresholds are more likely you would more likely cross the evidence threshold when there is random assignment. As researchers, we struggle to actually do studies with random assignments often because of the lack of funding to do these kind of studies. They are costly. And I was wondering to what extent policymakers can help produce that information by phasing out policies by some random mechanisms that we can really study them and provide you with much better information in the long run.
So, great question. I think our current team at OMB, I work for a woman named Aviva Arendine, who's the head of economic policy, who's an MIT PhD, who's specializing in program evaluation. And so we've been having lots of discussions about a few things. First of all, how we can improve the quality and lower the cost of high-quality studies, particularly random assignment, but also good quasi-experiments. And a lot of that has to do with finding reliable, rich sources of administrative data and enabling people to get access to them. So we are in the process of organizing some agency workshops to think, because there have been some agencies who figured it out and are doing this more routinely, and others that, you know, it takes 2 years to get an MOU set up to share our data between SSA and HHS. So certainly we're trying to do that. We're hearing lots of interest from the academic community saying essentially, hey, you know, you don't have to go and hire that really expensive contractor. We can do a high-quality random assignment study for you with our top grad students if we can just have access to administrative data. And that's a conversation that can be happening at every level of government, because most of the data for a lot of these programs reside at the state and local level. We're also trying very hard to get people to think differently about what it is that we're evaluating. We had in the Bush years, for all the good things we made progress on, we also had this mentality of the program as the unit of analysis. And it's really hard to do good random assignment studies of whole programs that tell you anything interesting. What we really want to do is we want to seek out the variation and figure out what are the strategies that make the most difference and test them and prove them. So we're trying to change that conversation with federal agencies and make people recognize that in virtually every one of our large grant programs, there's huge opportunities for doing random assignment studies. You just have to find the willing parties who are making decisions saying, you know what, I've got 2 or 3 theories of what's the best way to do this, and if I can get somebody to help me design something that I can test it, then that's good for me.
The only follow-up I would say is that, you know, what I had, through my question, what I had expected that random assignment would come actually from the policy side, not from the researcher side. Much like how Oregon experiment, when they expanded Medicaid, they did this lottery of who gets, you know, on Medicaid and not. And so it really, the researchers didn't design the study. The researchers got access to the data. But the random assignments was determined by the policy side in phasing out the policy.
So I think I would say that, except I would tell you, most policymakers are not going to come in a meeting saying, I want to do a random assignment study. They're going to come in saying, I want to figure out how to improve my program. And it's those conversations that happen. I mean, Becca was a master at this at the education department, like figuring out how to get the conversation starting between the researchers and the policy and the program people to say, this is an incredible tool for you.
And speaking of conversations, I think the time for this conversation has ended, but we can continue this overlap. Thank you.